There are many fantastic charities out there helping people both physically and mentally. Pets as Therapy is one.
Kate, Doug is adorable. What's your role as a volunteer?
Well, Doug's my dog, and he lives with me in my house. And I just felt he was a really lovely, soppy, gentle nature and totally predictable in his actions. I applied with Pets as Therapy for him to become a therapy dog. And they can find you placements, or I can find somewhere dear to my heart that I'd like to contribute to. And then we volunteer together. I work 4 days a week with Doug, but you can just work as little as one afternoon a month or one evening a week or whatever. Doug and I work in 2 mental health units in London. We also work in school on a reading programme and in a behavioural unit with children who are either excluded from school or find school life quite difficult because of their emotional challenges. And we work in a hospice with people with life-limiting conditions, and a hostel for those between permanent homes, and a care home for the elderly.
So for children, if they're reading, does he bring them confidence?
He does. So it's really lovely when the children read to Doug. He cocks his little head and he shows interest and he loves it. They get used to being listened to and being heard. And Doug doesn't correct or interrupt, which means that it's a lovely way for them to gain confidence and just grow in their reading and also their confidence generally in school and make school a happier place for them to be.
I'm always in awe at how much dogs help the human race. They connect with us in a way that's very, very simple, yet very, very powerful. Perhaps if you sat at home with your canine friend, you might consider becoming a volunteer.
Kate's with me now, along with Lindsay Uglow from Pets as Therapy. And who is this?
This is Leo.
And what does Leo do?
Well, Leo and I visit Southampton Children's Hospital 3 times a week, and we see all sorts of children, from outpatients right up to intensive care, and the children's oncology ward too.
And what effect do you think he has?
Well, he has lots of effects just as a social interaction for children and their siblings when they're in hospital. The hospital's a very alien place for children. But he also is, he's a great icebreaker. So if the staff want to sort of maybe moot the idea that they might need a blood test to be taken or something, then we can try and distract the major issue of that happening by bringing the dog in. They can stroke the dog and you know, consider having just a little blood test for what would be a little blood test for an adult, but have that done with the dog there.
Kate, do we know the sort of numbers of dogs that are being used in this way at hospitals around the country, at children's homes I know as well?
The numbers
Yeah.
currently are not as high as they could be. And I think what's really nice about volunteers like Lindsay with Leo is that people at home right now with their dogs, it doesn't have to be dogs, any pets. You know, they get them checked over, make sure they're behaviourally okay, but they could volunteer. And there are so many good charities out there. That, yes, I think they need more. They're looking for more volunteers to go out there with the dogs and other pets.
And it's a great distraction. We'll talk about the sort of medical,
Yeah.
the science behind it in a moment, but it is a great distraction. And actually we've got some pictures of children who have been visited by dogs, and you can just see. This is little Joseph Williams with Rossi. This was at Southampton Children's Hospital just recently, actually, and it really comforted him. And he was at Great Ormond Street before that, and you can
Alice.
see here Alice. This is your dog?
Leo,
Yes.
with Alice, yes. She's one of our patients. We've been seeing her for 4 years.
And she must absolutely love it when he comes in. And
There's
there with
Archie.
And that's
There's
Leo
your
again.
patient.
Yeah. Look at Leo with his paw up there on the bed.
Yes.
And do you find that he really responds to them? He knows what he's doing. Here he is with Oscar.
Yes. So, I mean, the thing I find with Leo is that the sicker they are, the calmer he is. So, you know, in outpatients it's relatively busy. Actually, in intensive care, he just calms completely, and he's very quiet in there. And obviously we have to take precautions to, you know, make sure that his paws don't actually touch the patient's bed. So we put pads in between their linen and our paws. But it's a great thing to do, and to see the smiles, not only of the children there, but actually the relief when a child in intensive care smiles for the first time is amazing
And as
for
well
the
as
parents.
exactly, but as
Yes.
well as having that sort of feel-good factor, is there sort of clinical research that proves that it can be helpful?
There is research. There's lots of research overseas. In America, they use therapy dogs a lot, and there's lots of research. There will be some research being done in the UK very shortly, which we're going to be part of. Which will be great, and we just need to get out there and do more of it, really, because I see it, and the staff, in the children's hospital see it, He's getting very tired.
Yes.
But what we need to do is prove it.
Yeah.
And it's not, like every branch of healthcare, it's not for everyone. But, you know, for those people that like it.
Exactly, and Kate wants got to be certain that the person you're approaching with the dog has agreed and is happy for that to happen.
Yes, and I think certainly with dogs, you know, I mean, that there's evidence there that it lowers the blood pressure. But I think we all know, if we sit at home with your dog, you're stroking your dog, it brings a certain calmness. You can feel your stress levels going down. I mean, they just benefit us all.
Well, Leo's had a long day, so we're going to let him go home now. Thank you so much, Lindsay, for
You're
coming and
very
talking
welcome.
to us and for bringing him, for all the good work that you're doing with him as well. And thank you to Kate. Right now, Leo's actually been talking to somebody who's been long involved with Pets as Therapy.
Lovely to see you here.
And you?
Are you overwhelmed sometimes at the love the public have for you? Because this is one of the biggest crowds I've seen all weekend.
I mean, love for me, that's fantastic. I didn't even think about that, because the thing that is overwhelming about crafts is that there is so much love in these halls. It's this lovely atmosphere of love.
Do you think the world could learn something from the people of Crufts?
Damn right.
Yeah. And you've cut a big cake today as well. I'm hoping I'm going to get a slice of that. Or is it doggy cake? Is it human?
No,
cake?
I know what it is. It's a very
Let's do it
special
inside.
cake. It's a lemon drizzle. So it's not a doggy cake at all.
And Pam, what do you think makes dogs so special to us?
I can only speak for myself. And I was brought up with dogs, working dogs, in fact, because I was brought up on a farm. So we had working collies. And, do you know, I have a feeling that there's something that you either have a bond with animals or you don't. And I had an immediate bond with animals, not just because I was in an animal environment. There's something there. You're born with it. And I wanted to be a vet as well.
And is that why you're associated to some fantastic dog charities?
It could well be, yes. But it's important, of course, for people in my position to choose, not to just sort of turn up to the opening of every envelope, but but to have something that you care about and you're passionate about. That's, I think, very important.
And breeds of dog?
This isn't my particularly favourite day. I mean, I love all dogs, but I should be coming on Terrier Day, basically, but I couldn't get here on Thursday. But even if I died tomorrow, I would be happy, because a Westie won last year and a Scottie won the year before.
Do you know what? Keep up all the fantastic work you're doing. It's lovely to meet you and see you here.
Oh, thanks very much indeed.
And, I'm definitely going to tap you up for a cup of tea and lemon drizzle cake.
I'll see what I can do.
Thank you.